Welcome everyone to a very special episode of the Shade and Shit Talking podcast, powered by Black with No Chaser. As always, I'm your host TK, and I thank you for tuning in. Now, this episode will be a departure from the norm. It will not be my usual Shade and Shit Talking episode. Normally I would do something, pertaining to current events or something in the news or something big that happens, followed by maybe some political talk, music, entertainment news, sports, and my personal favorite, colonizer nonsense. Well, I won't be doing that this week. This week I will be, first of all, keeping it, short and sweet and to the point, but I will be focused on one topic and one topic only, and that is breast cancer. With this month being International Breast Cancer Awareness Month, I decided to focus on this and talk about this, give the statistics and, give a little insight from the research that I was able to comb over and use this platform as a way to reach out to others who may be suffering from breast cancer or know someone who may be suffering or really unsure of if, the symptoms and risk and whatnot. So with that being said, let me just say that I am by no means a medical professional. This is not in my wheelhouse. This is not something that I normally talk about, something that I normally research. But this episode is coming from a place of love. It's coming from someone who really loves and appreciates not only women, but more specifically Black women. And this is coming from someone who realizes and recognizes the struggles and the problems and the overall, shit that Black women go through. And I'm using this as a way to, show them love and respect and try to help in any small way that I can to make their daily lives a little better. So, once again, I'm not a medical professional, and anything that you hear today, understand that I, researched and cross-referenced from multiple sources to make sure that I'm giving out the most current and up-to-date, the most honest, the most accurate stats, and just overall information that I possibly can. And anything that you hear today, if I've made a mistake, please don't hesitate to call me out on it, because it will only help make this better, help other people to get better. So with all of that being said, I'll just get right into it. So I'm going to start off just talking about just the basic overall numbers, the staggering numbers involved with breast cancer. And most the numbers that I'm giving you now, I got from a couple of sites, but most currently was breastcancer.org. Now, 1 in 8 U.S. women, about 12.4%, will develop invasive breast cancer over the course of her lifetime. In 2018, an estimated 266,120 new cases of invasive breast cancer was expected to be diagnosed in women in the U.S., along with 63,960 new cases of non-invasive in situ breast cancer. About 2,550 new cases of invasive breast cancer are expected to be diagnosed in men in 2018. A man's lifetime risk of breast cancer is about 1 in 1,000. So it's very commonplace for women, and it's very, very rare in men, but it does happen. Breast cancer incidence rates in the U.S. began decreasing in the year 2000 after increasing for the previous 2 decades. They dropped by 7% from 2002 to 2003 alone. One theory is that this decrease was partially due to the reduced use of hormone replacement therapy, HRT, by women after the results of a large study called the Women's Health Initiative were published in 2002. These results suggested a connection between HRT and increased breast cancer risk. About 40,920 women in the U.S. are expected to die in 2018 from breast cancer, though death rates have been decreasing since 1989. 40,920 women are expected to die in 2018 from breast cancer. Women under 50 have experienced larger decreases. These decreases are thought to be the result of treatment advances, earlier detection through screening, and increased awareness. For women in the U.S., breast cancer death rates are higher than those for any other cancer besides lung cancer. Besides skin cancer, breast cancer is the most commonly diagnosed cancer among American women. In 2017, it's estimated that about 30% of newly diagnosed cancers in women will be breast cancers. In women under 45, breast cancer is more common in African American women than white women. Let me say that again. In women under 45, breast cancer is more common in black women than white women. And I will, really get into the effects it has on black women in a little bit. But overall, black women are more likely to die of breast cancer. For Asian, Hispanic, and Native American women, the risk of developing and dying from breast cancer is lower. As of January 2018, there are more than 3.1 million women with a history of breast cancer in the U.S. This includes women currently being treated and women who have finished treatment. A woman's risk of breast cancer nearly doubles if she has a first-degree relative. A mother, sister, daughter who has been diagnosed with breast cancer. Less than 15% of women who get breast cancer have a family member diagnosed with it. About 5 to 10% of breast cancers can be linked to gene mutations, abnormal changes inherited from one's mother or father. Mutations of the BRCA1 and the BRCA2 genes are the most common. An increased ovarian cancer risk is also associated with these genetic mutations. About 85% of breast cancers occur in women who have no family history of breast cancer. These occur due to genetic mutations that happen as a result of the aging process and life in general, rather than inherited mutations. And finally, the most significant risk factors for breast cancer are gender, being a woman, and age, growing older. Now that I have, given you the overall statistics involved with breast cancer, let me give you the numbers pertaining to young black women and black women in general. So here's the problem. Every year, 24,000 black women under the age of 45 are diagnosed with breast cancer. and as a result, about 3,000 would die. Young black women under the age of 35 have breast cancer rates that are 2 times higher than Caucasian women of the same age. Let me repeat that. Young black women under the age of 35 have cancer rates that are double the rates of white women at the same age. Furthermore, young black women are 3 times as likely to die from breast cancer as Caucasian women of the same age. Once diagnosed, young black women face unique challenges that are either not present or are less severe for older women. Having a breast health course of action and discussing the significant implications of a breast cancer diagnosis is essential for young black women in taking care of their health. Now, younger women, they tend to face more aggressive breast cancers. They're diagnosed at later stages, and as a result, they have lower survival rates. Black women aged 45 and younger are more likely to have higher grade tumors, larger tumor sizes, and a higher comorbidity of lymph node involvement than women over 45. The relative 5-year breast cancer survival rate is lower in women diagnosed with breast cancer before the age of 40, that's 82%, compared to women diagnosed with breast cancer at the age of 40 or older, that's 89%. Now, being aware of these risk factors and consulting a doctor about breast health is important for young black women to mitigate and manage their risk of getting breast cancer. And I'll talk about the risk in just a little bit. Now, here's another significant problem when it comes to breast cancer, and it's like any disease in the black community, as well as mental health. There's a certain stigma involved with sickness in the black community. Like if any of you heard the mental health podcast that we did back in May for Mental Health Awareness Month, Calibri and Lars both talked about the stigma associated with mental health in the black community and how we just don't talk about it, or we try to pray it away. And this is no different. There's a stigma associated with breast cancer that's right in line with fear, and those two things cause a lot of black women to not get diagnosed as soon as they can, or as early as possible, because they fear what might happen. They don't get the mammograms and whatnot. So it affects our community very much so, not only health wise, physically, but mentally. Now, the lack of awareness among black women on their risk for breast cancer is often a factor into why they have more harsh outcomes. Approximately 40% of young women with breast cancer had no idea a young woman could get breast cancer prior to their own diagnosis. And like I said, fear and stigma are commonly cited reasons for not getting a mammogram. And it's unfortunate that, cultural barriers, which I feel fear and stigma are cultural barriers, associated with illness and poverty, deter black women from getting breast cancer screenings, which results in a late stage diagnosis. Also, lack of dialogue amongst families about generational health and increased risk are key barriers to women taking the steps to minimize their risk of breast cancer. So, if you are a young woman under the age of 45, here are some of the reasons why you may be at a high risk for breast cancer. You have a close relative, like I said earlier, who was diagnosed with breast or ovarian cancer at a young age, younger than 45. They have other breast health problems or were treated with radiation therapy to the breast or chest during childhood or early adulthood. And they have changes in certain breast cancer genes or have close relatives with these changes. Now, with all diseases, there's always the questions asked, like, how do we prevent this? How do we stop this from happening? And, basically you can try to reduce the risk of getting breast cancer. Now, unfortunately, there's really no effective method of screening for young women. The CDC says they should suggest that young black women should be familiar with how their breasts normally look and feel, and be aware of the signs of abnormal breast health in order to take proper steps to manage their risk. They say that knowing the signs of breast malignancy can save their lives. 80% of young women ultimately diagnosed with breast cancer find their breast abnormality themselves, and the earlier that is found, the greater the survival rate. More importantly, they go on to say that black women need to feel comfortable and even encouraged to talk about their bodies. Recognizing the signs of abnormal breast health and consulting a doctor to assess concerns if any known symptoms appear is important to reduce the risk of breast cancer in young black women. So now, that we that I kind of talked about, the risk, I think it's important to talk about some of the symptoms that's involved with breast cancer. So different people have different symptoms, and some people don't have symptoms at all. But here are some of the warning signs, some of the symptoms, possible symptoms of breast cancer. And once again, this is according to the CDC. This is also according to breastcancer.org and a few of the cancer organizations that I researched and looked up to really talk about this. But some of the warning signs of breast cancer are new lump in the breast or underarm, in the armpit area, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, a nipple discharge other than breast milk, including blood, any change in the size or the shape of the breast, and pain in any area of the breast. Now keep in mind that these symptoms can happen with other conditions that aren't cancer. So if you have any of these symptoms, and it worries you, or even if it don't worry you and you notice some of these, be sure to go talk to your doctor, your primary care physician, right away. So now that I have talked about symptoms, let's talk about risk. Now, studies have shown that your risk for breast cancer is due to a combination of factors. As I said earlier, the main factors that influence your risk include being a woman and getting older. Most breast cancers are found in women who are 50 years old or older. Some women will get breast cancer even without any of the risk factors that they know of. And also, having those risk factors does not mean that you will get the disease. And not all risk factors have the same effect. Most women have some risk factors, but most women do not get breast cancer. If you have breast cancer risk factors, again, talk to your doctor about ways you can lower your risk and to ask about different screenings for breast cancer. So with these risks, there are risk factors that you cannot change, and there are some that you can change. So I'll start with the ones you cannot change. Getting older. That's number one, getting older. The risk for breast cancer increases with age, and most breast cancers are diagnosed after 50. 2, genetic mutations. These are inherited changes to certain genes, like I said, the BRCA1, BRCA2, and women who have inherited these genetic changes are at a higher risk of breast and ovarian cancer. 3, reproductive history. Early menstrual periods before age 12 and starting menopause after age 55 expose women to hormones longer, raising their risk of getting breast cancer. 4, having dense breasts. Dense breasts have more connective tissue than fatty tissue, which can sometimes make it hard to see tumors on a mammogram. Women with dense breasts are more likely to get breast cancer. 5, personal history of breast cancer or certain non-cancerous breast issues. 6, family history of breast cancer. And I talked about that earlier, having a mother, sister, or daughter, which is referred to as a first degree relative, or multiple family members on either side, whether it's maternal or paternal, that have had breast cancer. Even if it was a male, having a first degree male relative with breast cancer also raises a woman's risk. Let's see. 6 is previous treatment using radiation therapy. Women who have had radiation therapy to the chest or breast, like, for instance, if you were treated for something like Hodgkin's lymphoma before the age of 30, you have a higher risk of getting breast cancer later in life. And finally, women who took the drug diethylstilbestrol, DES. It was given to some pregnant women in the United States between 1940 and 1971 to prevent miscarriage. They have a higher risk. Women whose mothers took DES while pregnant with them are also at risk. So now, let me talk about the risk factors that you can change. Number 1, not being physically active. Women who are not physically active have a higher risk of getting breast cancer. 2, being overweight or obese after menopause. Older women who are overweight or obese have a higher risk of getting breast cancer than those at a normal weight. 3, taking hormones. Some form of hormone replacement therapy, those that include both estrogen and progesterone, taking during menopause can raise risk for breast cancer when taken for more than 5 years. Certain oral contraceptives, birth control pills, also have been found to raise breast cancer risk. 4, reproductive history. Having the first pregnancy after age 30 not breastfeeding, and never having a full-term pregnancy can raise breast cancer risk. And finally, drinking alcohol. Studies show that a woman's risk for breast cancer increases with the more alcohol she drinks. Research also suggests that other factors, such as smoking, being exposed to chemicals that can cause cancer, and changes in other hormones due to night shift working, also may increase breast cancer risk. So, I talked about the risk factors involved, and I kind of talked about the many factors over the course of a person's lifetime that can influence breast cancer risk. You can't change some factors, like I said earlier, getting older or your family history, but there are ways that you can help lower your risk of breast cancer by taking care of your health in the following ways. So, according to CDC and others, there are ways you can lower your risk. First one they say is to keep a healthy weight, to exercise regularly. They say don't drink alcohol, but I mean, people are grown, they drink. So, but they do say if you can't not drink, at least limit your alcoholic drinks to no more than one per day. If you are taking or have been told to take hormone replacement therapy or oral contraceptives like birth control, ask your doctor about the risk involved and find out if it's right for you. If you are pregnant and have babies, breastfeed your children if possible. And if you have a family history of breast cancer or inherited changes in your BRCA1 and BRCA2 genes, talk to your doctor about other ways to lower your risk. Staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving breast cancer if it occurs. And in closing, I just want to say that I guess the best thing would be to be proactive. I understand that, especially in our communities, there are challenges that we face as far as not being insured or being underinsured, as well as fighting those stigmas and fear and mental barriers that we have become conditioned and accustomed to. Like I said earlier, we tend to have the mindset of when things go wrong or we feel bad or whatever, we want to pray it away. And don't get me wrong, whoever you believe in or whatever you believe in, or if you don't believe in prayer or whatever, that's your choice. But just praying it away doesn't work. I'm sorry, it's not an option. You have to pray in and put in the work. Go see a specialist, go see a doctor. Just praying it and as my grandmother used to tell us, just give it to Dr. Jesus. Doesn't always work, especially with something as devastating and debilitating as breast cancer or any cancer, for that matter. So let me just give you the bottom line when it comes to this and black women. Of all new cases of breast cancer in the U.S., 11% are found in women less than 45. young black women are disproportionately affected by breast cancer compared to young white women. Death rates due to breast cancer are 3 times higher in young black women than in young white women. Being aware of abnormal breast health and consulting a doctor to discuss risk management is very important, and it is an important way to reduce breast cancer in young black women. And once diagnosed, black women face unique challenges that should be discussed with a health care team. So for all of you who listen to this episode of the podcast, I hope that the information that I that I gave you, helps you, or helps you to help someone else. I hope that this small part that we hear Black with No Chaser and Shade and Shit Talking is playing. If it helps one person, we've done something good. And just like the idea of Sankofa, each one teach one. That's what we're doing here. So as all, like I said, your physical health is important, your mental health is important. Be proactive instead of reactive. And if you catch it, or if you don't catch it and you have to be reactive, be very diligent in what you're doing. Remember to get screened. Your first line of defense is to perform a self-exam at least once a month. Because 40% of diagnosed breast cancers are detected by women who feel a lump. So establishing a regular breast self-exam is very important. Another proactive method is being screened by having a mammogram, which can help detect breast cancer very early before symptoms even appear. And it finds the disease earlier, makes it easier to treat. So I know all of this could be overwhelming. I know it all could be a very scary process, but in all things in life, knowledge is power, and knowing sooner rather than later can improve your odds of survival. So I thank you for listening. I hope that these words help you. I hope that if it doesn't apply to you, you take it and pay it forward to help someone else. And this has been a very special breast cancer awareness episode, brought to you by Shade and Shit Talking, powered by Black with No Chaser. And I will most definitely talk to you guys next week.
Oh, thank you.
The podcast you just heard was published with Anchor. Got something you want to say to the creator of this show? Send them a voice message using the Anchor app, free for iOS and Android.